So my name is Karen Neurohr. Today is March 2nd, 2022, and I am at the Eisenhour Funeral Home in Blanchard, Oklahoma. I'm with the Oklahoma Oral History Research Program at the Oklahoma State University Library, and today I'm talking with Mr. Mike DuBois about his experience during the COVID-19 pandemic in Oklahoma. We will be focusing most of our time discussing his role as the owner and director of the funeral home, but I have some more general questions about life during this time. For the record, Mike is a former student of mine many years ago at Poto High School in Oklahoma. Upon the agreement of Mike, this interview will be archived at the Oklahoma State University Library for future generations to see. This project is supported through the Institute for Museum and Library Services American Rescue Plan grant funds. And thank you, Mike, for participating in the interview.
It's my pleasure.
So let's start with just tell me a little bit about yourself.
Well, I'm Mike DuBois. I own and operate the Eisenhour Funeral Home here in Blanchard. I bought the funeral home business from the Eisenhour family in 2011. So for the last 10 years or so, I have owned and operated the business here and been, until very recently, the only funeral director here in our small town of Blanchard. I grew up in a small town in Poto, Oklahoma, in eastern Oklahoma. And after I went to finish my schooling there, I did go to Oklahoma State and graduate from OSU in 1997. So my family all also went to Oklahoma State. My dad and my brothers are all veterinarians and went to vet school at OSU, and I went a different route than vet school. So I'm married. I have a beautiful wife. Her name is Christy. We have two children, Hunter, my son Hunter, who is 22, and he's married to Abby. They have our first grandbaby. Her name is Gracie, and she is just a little over she's almost 10 months old. And then I have a daughter, Claire, who is 13.
Okay. So you did your undergraduate studies at Oklahoma State University, but then you went to school after that too,
I
right?
did. I went to school. I got a bachelor's degree from Oklahoma State because that's what I needed to do to stay in the good graces of my family. And of course, I just wanted to because I love OSU. And when I graduated from Oklahoma State, I went on to the University of Central Oklahoma in Edmond and got a second bachelor's degree in funeral service education. It's the only funeral service program in the state of Oklahoma. So, and it was the actual, the first bachelor's program that was offered in the nation in funeral service was offered at UCO. So there are some other programs now. It used to be considered more of a trade. And so a lot of times it was more like an associate's degree or something like that. And so that first bachelor's program was in UCO. And since I already had a bachelor's degree, it was very easy to get a second bachelor's degree in a pretty short amount of time. So.
Now, is your OSU degree in sociology?
In sociology, yep.
Okay, so tell me a little bit about your business here.
We're a full-service funeral home offering both burial and cremation services. On the average, when I bought the funeral home 10 years ago, we were handling roughly around 120 deaths per year. Blanchard is a small town. We do cover some of the surrounding areas, the rural areas around here. This is the only funeral home proper in Blanchard itself. We do have some in some neighboring towns of Tuttle and Newcastle, but it's the only funeral home here in Blanchard. It's just been a pretty steady business. And then once the pandemic hit, our call volume jumped fairly significantly for our funeral home. We went the first year of the pandemic, we ended up having about 155 deaths that year, which was a considerable jump from the previous year of around 120. And then last year in 2021, we had 158. So that prompted me also to kind of up my staff and figure out, how are we going to, if this is going to continue, how are we going to continue to serve the people of the community in the way that we need to and have the right amount of staffing for that.
Mm-hmm. So take me back to when you first started hearing about the coronavirus. What do you recall about when you first were realizing that this pandemic was going to significantly affect day-to-day life?
It was early in 2020. I guess it was in March when it kind of came about that this thing was happening. And at that time, it was still very much on the West Coast. It was in Washington State. We were hearing stories about, this virus and what it was doing. There was a nursing home facility somewhere in Washington State that there were many residents, caught the virus, ended up dying from it. And in Oklahoma, always felt like we're sort of still in the Wild West sometimes. People don't necessarily always want to heed the warnings and the rules and things. And so it did take a while really before it started showing up here. We had a few, through the summer months, we had a few deaths that were attributed to the coronavirus. We were seeing that come back on a death certificate. And, during that time, we began to have the questions of, is it safe to be around someone who has died from coronavirus? So from the very beginning, the CDC had sent a bulletin out to funeral homes and let us know that if a person's body is embalmed, we believe that it's safe to be around that person for the purposes of the funeral home and the funeral itself, where we could have an open casket viewing and we could have a traditional funeral. The recommendation was that there not be excessive, that the family members and friends not excessively touch or handle the body, or that they not kiss the body, which sometimes happens. But so we felt like, if someone was embalmed, that they were safe to be around. I knew it was we knew it was an airborne virus. We knew that if, the person who had passed away obviously is not breathing, so we didn't feel like, unless we moved them in such a way it was causing air to be expelled from their lungs, that they were safe to be around. Of course, we practice what's called universal precautions, where we wear personal protective equipment, gowns and gloves and face shields and things like that when we're doing our embalming work. And OSHA says that we need to treat every person that we handle with universal precautions. So we don't know, because of privacy laws, historically we don't know if somebody died of a communicable disease or not. There were some things that kind of changed with the coronavirus, where now we get notified, where before we didn't. So our charge is that we would treat every person that we handle, every deceased individual, as if they were contagious with something, so that we protect ourselves, we protect the general public and the public health. So we were already doing that, but if you knew that somebody had something that was potentially contagious, you might be extra careful, But we were already supposed to be practicing those universal precautions, and we do. Once the governor started putting in restrictions in Oklahoma, every other state in the nation, had done something, and it was time for Oklahoma to do something as the pandemic kind of became more and more prevalent in the state of Oklahoma. They put in some restrictions where they basically said that funerals had to be limited to 10 people. 10 people is not very many people. So through that period of time, and also they had said anyone who is over 65 years old is safer at home. So I had several employees that were part-time employees. We have a lot of retired gentlemen that help with funeral services and things. They all got grounded, basically, weren't coming to work because of the state's quarantine and restrictions that we were under. And then they said funerals could only be 10 people or less. So for a period of time, there was a few months where basically all we did was graveside funerals. We tried to limit those to 10 people. It's very difficult, even just with immediate family, to have less than 10 people in a lot of situations. And how do you tell one sibling or one grandchild, you can come, but the rest of you can't? So there were times probably that we did have more than 10 people, but we were having services outdoors. We were having them as a graveside service out in the cemetery in the open air, and I felt like that provided the opportunity for people to spread out, and if more than 10 showed up. But we did stress to our families that, we want to be a part of the solution and not part of the problem. There were a lot of questions about what was necessary and what was not necessary. So it was a very different time. And then once those restrictions were lifted, it was like things just sort of went back to, bigger crowds, that sort of thing. We did see a lot more mask wearing. We wore masks historically in any crowd, provided sanitizer, things like that for, people to use, and kind of tried, if we could, through signage and different things here in the funeral home, to discourage a lot of close contact. Those were the kind of the things that we were suggested to us, and how do we work our way through this and still provide services to families in need and have funerals, which I think are very important. But how do we do that in this pandemic? And so I would even say today, 2 years into the thing, we still have some questions, and we still don't always know if what we're doing is exactly the right thing. There's just so much information that's contradicting, coming from different places. I mean, everybody's familiar with that. So what else? Does that answer your question?
Mm-hmm. Yeah. So did you do any online or virtual?
We did. We did have some instances where we had a lot of older folks or folks who were did not want to come and be in a public group, and so we did begin offering online services where we did basically live streamed services. I have the equipment now to do that. We don't do it all the time. We still do it some. We were. There was a period in time, too, where when we were limited to 10 people, I was making a video recording with the family's permission of the service. And then those that couldn't come, that wanted to come, would be able to watch the service back afterwards. We were posting those on our website. We're not doing that very much right now anymore, but we still have instances where someone's very elderly or they're may not be well, can't come to a funeral, and we've been still providing live streaming on a case-by-case basis.
Did you have to adjust the cost for your services to?
I didn't.
Factor that?
There were other funeral homes that I'm aware of that were charging a fee for that. I felt like, and I have my philosophy on funeral services is that it is a living and it is the livelihood of my family and my employees. But we have just tried very hard to keep costs down at any point in time. There's a lot of things that we absorb. I'm not trying to get rich. I'm just trying to take care of people. And so I had to buy some video equipment. I have to pay a monthly fee to a company to host these live stream services. And at this point in time, we've been, doing it now for a year and a half. I haven't charged any family any different price for that. It's because I think that they're victims of circumstance and they don't need to be penalized for that. And if I have the means to take care of that for them, that's what I want to do.
How many employees do you have?
Well, currently I have myself, and then I have 3 other full-time employees and 2 part-time employees. So there's 6 of us.
Mm-hmm. Did you had already mentioned that your employee situation changed mainly because of age?
Yes, we had one. I had an employee who was kind of my right-hand man. He passed away at the end of December. He had worked here for the Eisenhour family before I bought the funeral home, and had almost put in 30 years when he passed away. But it was not COVID related.
Mm-hmm.
He died in December, at the end of December, and then my office manager, who was also here when I bought the funeral home, she had worked for the Eisenhowers prior to. She'd almost put in 30 years. She retired.
Mm-hmm.
She's been trying to retire for a while. I wouldn't let her. So I finally said, okay, I'll let you retire. But we're trying to get her to come back part-time. So.
Is that because of her knowledge?
Yeah.
Mm-hmm.
She knows all about all the paperwork and all the office stuff that the rest of us are kind of trying to share the duties right now. And I think in the few weeks that she's been gone, we've just gotten further and further behind. So.
Okay. You mentioned CDC sent out some guidelines for your industry.
Yeah.
So were there other information sources that you relied on?
Just the news. You know, I would watch the news very regularly. Sometimes I'll watch the news, even though it's the same thing. I'll watch it, 2 or 3 times a day. I just especially like to watch the weather, just because of the nature of our business. We're outside a lot, and I want to know if I go to the cemetery if it's going to be raining. And I know in Oklahoma the weather changes, every 30 seconds or so. So I always watch the newest, most recent weather forecast to see if anything changed. But I was watching the news to see what was happening nationwide with the coronavirus, what the guidelines were going to be, and they changed quite a bit. We also, we were told that we needed to upgrade and do better things with our personal protective equipment, that, now we needed to wear an N95 mask. And in the beginning stages of things, there was a shortage of personal, protective equipment. There were in funeral homes couldn't get rubber gloves. Funeral homes couldn't get gowns to wear while we embalmed. Masks were hard to come by. So there was our Oklahoma Funeral Directors Association had worked with somebody at the state level to find some masks and other protective gear that we needed to do our jobs, and kind of co-op that with funeral homes in the state. And we all went in, pitched money in, and got a pallet of masks, and now they're everywhere. But there was a period of time in the early stages when nobody really knew what was going on, that we didn't have the things that we needed. We didn't have answers. We didn't have the equipment that we needed. So we were, trying to piece things together. Even medical places in town, like our nursing home here in town and our IMSA operation, they didn't have anything. And so they came to me and asked, do you have a way to get some of these things? So I had helped them find, through some funeral service providers, some PPE that they needed, disposable gowns and things that they needed. So it was a collective effort, at many levels across the state to try and get the answers and get the plan in place of what were we supposed to do. But it was a pretty unsettling time. I mean, we didn't really have a choice. Certain businesses shut their doors and said, well, we'll come back when the smoke clears. But in funeral service, we don't have that option. So if the weather's bad, if it's ice on the ground, if it's, whatever it is, if there's a pandemic going on and someone dies, we're expected to go. I always say we're kind of like the post office. So whatever's going on doesn't really matter. We need to be a constant in the equation where if somebody calls us and they need our help, they expect us to come. And so through that period, we wanted to maintain our relationship with our community and say, we're here for you if this happens. And even though we didn't really have the answers, we were just trying the best that we could to kind of figure out how to muddle through and like I said before, be part of the, as best as we understood, be part of the solution and not part of the problem. So we were urging people to wash their hands and stay away from each other. And, I didn't want one of our funeral services to be some kind of super spreader event, that caused us some kind of negative press or something.
Did you avoid that?
We did. And I know that through that time, and we had many times where we would go into a home where we knew that the person, they determined that the person had died of COVID, or there were family members in the house on the couch sitting there, that were sick with COVID. And so we certainly put ourselves at risk going into those situations and picking those people up. But we have a duty to take care of families and take care of our community. And so I was very fortunate through that whole period of time, and the rest of my staff as well, that none of us ever got sick during the height of the pandemic. I think we've all had it since, but but not during the time, before the vaccine was available and all that, when we just didn't know what was going on.
Mm-hmm. Were you all wearing cloth masks at first?
We were wearing cloth masks. We were sometimes using just a paper mask and a cloth mask. Once I was able to get those N95s, I distributed those to all my staff. We didn't have a lot of them, so sometimes we were wearing them for multiple times sometimes. And then when they got, too used, we threw them away and started over.
They're pricey.
Yes. They're not as pricey now as what I paid for these when we had them sourced. But anyway, yeah, we were wearing cloth masks. We were using hand sanitizer. We provided hand sanitizer, all over the building. I put signage up that said, avoid close contact, wash your hands, please wear a mask. Most of the time, most people were compliant with that. If we asked them to please wear a mask, I was afraid that if I told someone you have to wear a mask, that I was going to get punched in the nose. So I didn't ever do that, but we did say masks are recommended. My staff and myself, we always wore our masks, and most of the time, people would follow suit. There were always in any crowd, there's always seems to be one person that's just, I don't believe this, and I'm not going to do that, and So to avoid conflict and confrontation, we just stayed away from them. But every once in a while there would be somebody that was that way. But for the most part, we live in a great community, great people, and most people here are reasonable and understood that, that was as much for their safety as anyone else's. And I was, I know I was exposed. We were be exposed at funerals and exposed picking people up and exposed when meeting with families who had COVID in their home. And, interaction with the living was more frightening to me than the handling and the preparatory work that we provided for someone who had passed away with COVID.
Mm-hmm. Did you have, because of the increase in the services that were needed and have been for 2 years now, I guess, did it pose challenges with scheduling?
Yes. And at that time and it was up until very recently, I was the only funeral director here. I have two other funeral directors that work for me now to help kind of share the load. But in the first year of the pandemic, and at the end of 2020, when things really kind of came to a head in Oklahoma, we started seeing a kind of a surge in deaths. In the month of December specifically, it was about the second half of the month of December. Our phone started ringing on about December the 14th. And I remember that day. We had three people pass away that day. And I said to my staff, I said, well, we have had 3 deaths. So we were already busy this week. It's a small town and we're a small operation. By the end of the month of December, we had in that 2-week period roughly 25 deaths. And so there was a period of time where we had 10 or 11 or 12 people that had died that were in our pipeline, so to speak. So they were, I was meeting with the family to make the arrangements and then waiting to have the funeral and the burial. And so every time we were having 2 funerals a day. Is about all I could do by myself. I would come back from the cemetery and say, well, we're down to 7. And my office manager would say, 2 more people passed away while you were gone. And so it was like we were kind of in this cycle where there was a couple of weeks there, I had multiple families that I was dealing with, and I went home kind of in the middle of that, and I was worn out, and anyway, I cried about it, and I said, God, I don't think I can take care of these people and these families in the way that they deserve, and God gave me the strength. We persevered. We made it through. Everybody got taken care of. I was just afraid that if that continued, that I was just not going to be able to handle it, and that the families that we serve were going to get shortchanged, and I certainly did not want that. So I look back now, and I'm not really sure how we did it. I have a great team of people that work with me, and we took care of everybody, and everybody was taken care of in the proper way and in a dignified way. And but it was overwhelming, and if I don't think I would ever want to have to do that again. We've had a couple of other times where we've had another big kind of increase in really super busy months. And it just was never quite as that bad. But it's one of those things I don't, it did make me feel like now I can handle a lot more than I thought I could. But, this job has lots of challenges. It's, it's physically taxing and it's emotionally taxing, and, you have to give and give and give, and you give many times. I've been here long enough now that the people that I'm taking care of are families that I know, that I consider as my friends. Mm-hmm. And that makes it a little bit more challenging as well. But, by the time you get home sometimes to your own family, you don't have much else to give. And so, God bless my family sometimes, because they suffer the brunt of that, I think, sometimes. But,
were there other ways that you did self-care?
My self-care, I don't get to be alone very much. And so sometimes if I get to be alone just for a few minutes, even if it's just in the car, that's when I have time to kind of decompress. And then since I've hired some help, mm-hmm. that's helped me as well, just to have a little bit more time for myself and for my family. And like I said, we have a grandbaby now that was born last May, and so that changed everything as well. So I'm trying to be less obligated at the funeral home and more present at home some, and that helps me as well. I'm a Christian. If I didn't have my faith, I absolutely couldn't do this job. So I don't know if that answers your question. I sometimes, about all I do is sit in front of the TV and just watch whatever's on TV, just mindless stuff, and just sit in my recliner and rock sometimes. That's my downtime. I don't have a lot of downtime.
Mm-hmm. How did your sociology degree help you with this profession?
Well, I think that I knew when I went to Oklahoma State, I wanted to do something in the social sciences of some sort. So I actually started out. I was a psychology major for a little while, and then changed over to sociology. I've always been sort of a sociological observer. It's interesting to watch people. We get to see lots of groups of people at funerals, different types of families, people from different backgrounds, and it's interesting to watch people how if they see someone else behave a certain way, then sometimes they tend to behave that way as well. Even if they hadn't set out to do that, But I have always just loved people, and I've been told I was sort of an old soul, that I was able to, I would rather talk to, when I was a kid, I would rather sit down and have a conversation with adults than other kids. And so I've just always been able to relate to people. I think the sociology degree for me was sort of in the realm of what I wanted in the social sciences. Mm-hmm. And I felt like when I was in psychology that I sort of had a little conflict with my own personal religious beliefs with that, so I changed majors. Mm-hmm. So I don't know if that answers your question, mm-hmm. but I've just always related well to people, and love talking to people and helping when I can.
What supply chain issues have you had to deal with? I mean, we're looking at 2 years now, so that might have changed over the 2-year period. But you mentioned personal protective equipment is an issue in obtaining that. So what about things like that are needed for the services, the caskets, the flowers, the headstones? What about those types of things?
So in the early stages, it was that personal protective equipment, and that sort of has leveled out. We can get what we need. In fact, there was a surplus of things that was purchased by the state that they're providing to funeral homes now that we can get, I think, at no cost. But then right kind of that first winter when things kind of peaked out here, we were seeing problems getting caskets. So our casket suppliers...
Before the vaccinations really started rolling out? Yeah. Mm-hmm. Okay, sorry to interrupt.
That's okay. No, it was kind of that first wave of mm-hmm. When we started having that kind of surge of deaths that were COVID related. It was like after Halloween of 2020 up through probably February. There was just a lot of, it was really bad here, and it was bad all over. Our casket suppliers basically had told us, normally I could call, there's a warehouse in Oklahoma City for the casket company that we use. I can say, I want this particular casket. They bring it to me tomorrow. They let us know that they were having, nationwide issues supplying things, and that we needed to, if a family selected a particular casket, they needed to pick out choices B and C as well, mm-hmm. so that if we could have a backup and then a backup to the backup. So there was some times where we needed a particular casket. The family wanted a particular casket. We couldn't get it. We had to substitute. So that made things a little bit more complicated. And then it got better, and now we're starting to, in the last few months, we started to see that a little bit more. There was another kind of, I think with this last variant, there was another kind of surge in deaths where we went a period of months where we just saw very few deaths that were COVID related, and then we started seeing it again, and just like we did that December or that first winter where, this person's died of COVID, that, when we picked somebody up. They started after that first quarantine, the governor also did in that declaration of emergency or whatever was going on, they did mandate that healthcare providers, nursing homes, first responders, if anybody was aware that COVID was present in a house, or if the patient had passed away from COVID, that they told us that. And so we were getting disclosure of, we knew before we went into a situation, hey, this person passed away from COVID. And that was a new thing because of HIPAA and different things. Historically, for many years, we didn't know if somebody had hepatitis. We didn't know if somebody had AIDS. We didn't know. And that was when we talked, I talked about that universal precautions. So with COVID, they did tell these healthcare providers, if you're required to let the funeral home know. And so that's been helpful, just so that you know what you're walking into. Not that we don't already, try and do anything we can to protect ourselves, but it's always good to know.
Has that continued then?
Yes.
Do you feel like that's something that's going to remain?
I do.
Mm-hmm.
I do. I think that, and I understand privacy. We have we're obviously very aware of that. We know a lot of things. And we, with death certificates and things like that, there's a lot of private information on that. So we've always been very careful with information and people's personal and private information. But, we're seeing it now. It's becoming more the norm that they just let us know from the get-go, hey, heads up, this person has COVID or whatever. So.
Okay.
I don't really see how they could take it back away.
What about headstones and flowers? That kind of thing?
Headstones, we sell monuments here, and we've seen an issue with supply chain stuff there too. I'm sorry, I got off track.
No.
A lot of the granites and things, there's some granites that come from North America, domestic granites, and then there's a lot of different colors of granite that come from overseas, from China and India. And with both of those products, we've seen a lot of slowdowns. In the domestic granites, there was, a lot of the people that were working in those quarries stayed home. They didn't go to work because they could make more money at home than they could going to work. And so they got way behind on being able to get the granite out of the ground and processed and shipped out for monuments. So we're still seeing that. We went from being able to get a headstone in Georgia gray granite in 30 to 60 days. Now it's taking 6 months or more for those things to come from our monument company because they can't get it out of the quarry. The things that come overseas used to take 6 to 9 months to come on a container ship. Now the turnaround time on those things is like 12 to 15 months because they don't have anyone to unload. There's a bunch of these containers are still sitting out in the ocean somewhere waiting to be unloaded. So those kinds of things with transportation, it's affected every product at every level. I mean, if you've been to the grocery store, you know what I'm talking about. But it's it affected us too in that regard. So everything just taking longer. But we are, we're managing to continue.
Have you had to adjust? I would imagine you would have to adjust your prices because with the way the costs have fluctuated.
Yeah,
too. Yeah.
We have seen an increase in the cost of caskets and burial vaults and things like that. The costs of monuments have gone up as well.
Did you have any experiences related to COVID relief funding, small business?
I did.
Were you all considered essential workers?
There was a lot of question about that when we were all trying to figure out, when can we get vaccinated? There was at some level somebody said, well, you guys are the first, like a first responder, like like emergency room nurses or anybody else. We were supposed to be in line. But then when you went to the vaccine scheduler and you answered the questions, it asked you, are you a first responder? And so we didn't really know if we were supposed to answer that yes or no or what. So there was some confusion about whether or not funeral service employees were part of that first round of vaccine. And you almost had to answer the questions not quite honestly because of the way they were worded to get your name in the hat to get the first round of shots. The
relief funding?
The relief funding that we did, that there was a paycheck protection program that was offered for small businesses to help offset, to help continue to pay employees. Mm-hmm. If you were in a position where you were going to have to lay people off or that sort of thing, we did qualify for a paycheck protection program loan that was based on a percentage of our payroll. Because I did, we didn't ever lay anybody off, but there were times where we had people that couldn't come in just because we were trying to stay away from each other and do what we could, during that time. And I did get one of those federal loans, and then qualified for the forgiveness of that. So that was very helpful in that regard.
Did you have employees with children where schools were closing and that was affecting their ability to work too?
At that time, I didn't have any. The only person that worked here that had any school-age children was myself, and my daughter was homeschooled. And so when they started shutting the schools down, her life didn't change at all.
Okay, so there are a lot of stressors for everyone. And I know with your industry being a service industry the way it is, and you're focused in many ways on the families that you're serving.
Sure.
But you also have your staff.
Yeah.
So, and they were having stress too. So
yes.
How did you help them deal with the stress?
We talked about things together. I mean, there's discussions and things that happen, when it's just us that are different when there's other people in the building. And we talked about things, what did we need to do as an organization for us to be comfortable? What did we need to do to make the families that we serve comfortable? And so we talked about, if you want to wear a mask all the time, wear a mask. There were times when we didn't have families or services or anything going on in the building, and it's just the few of us here, and we were comfortable with each other, that we didn't always wear a mask around each other. We all tried to be careful. Nobody wanted to take anything home to our families at home. Some of my employees had spouses that weren't in great health, that, if they had picked up something here from the general public and taken it home, it would have been bad. So we talked together about what do we need to do. When we were slow and times were, there was plenty of time, then I let them have time off. We tried to kind of work with a proverbial skeleton crew, if I could use that term. That's probably not good for the funeral home, but when we didn't have to have everybody up here, we took personal time. We stayed home with our families and just kind of tried to handle things that way.
Have you changed anything in how you do your job because of the pandemic?
I think I'm certainly maybe a little bit more just careful with, we've always I've always washed my hands, and I've always just washed my hands, especially when I started working at a funeral home. There's things that you just want to wash off your hands. So, but I think just being cautious about being around other people, when I hear somebody coughing or something like that, used to, if you were in the store and you sneezed, someone stranger would come up to you and say, "Bless you," Now that somebody looks at you like, you better get away, what have you done, So I think just being more careful around people. I'm not really a hugger. So I don't hug very many people.
Are you a handshaker?
I am a handshaker. And so whenever, if somebody wants to shake my hand, I'll shake hands with them, and then I'll go wash my hands.
Mm-hmm.
And then otherwise, just being more cautious. As I mentioned before, we use those universal precautions, but just being aware that this, virus is out there and that it's so easily spread, and that we just try to be careful and just to be respectful of what other people, I take cues from other people. If they come in and they're wearing a mask, I'll ask them, "Do you want me to wear my mask?" Or I want people to be comfortable when they come in our funeral home. Most of the time when people come in here, it's already an uncomfortable situation. And so we want to set them at ease. We want them to be comfortable. We want them to know they can trust us, and that this is, that we're going to take care of them. So.
Okay, you talked a little bit about the Oklahoma Funeral Directors Association helping with obtaining the PPE.
Yes.
Were there other things that they did to help the members?
Again, they're a source of information for us. So when there was some kind of guidance or something that came from the World Health Organization or the CDC, then they distribute that to all of the member funeral homes in the state. So they kept us apprised of what was going on from that point of view via emails and things like that.
Mm-hmm.
We, there also were a source, if we needed some kind of answer about, clarification of what these restrictions were when we were working in a restricted time, what was right and what was proper. And so they were a good place to go and, get answers for those things. I know in the, and there were projections and things too from the State Department of Health early on about once this thing got rolling, how many deaths they thought that they projected that we would have within the state. And they had provided us with that information, which was interesting when we were kind of watching the case counts and the number of deaths that had occurred in the state. That first year, they thought by the end of the year there would have been around 700 or 800 deaths, I think, in the state of Oklahoma. And we know now that we've grossly surpassed that. So I don't think nobody really knew what to expect or how to predict. And so that, just hearing all this information and knowing that nobody really knows, it just makes things a little bit more confusing sometimes, in my opinion.
The Oklahoma Funeral Board is the regulatory agency.
Correct.
For your industry. Did any policies or regulations change because of the pandemic?
They were also, I don't think that they changed any of our statutes or board rules that I'm aware of. but they were also instrumental in disseminating information, from the governor's office and that sort of thing. Since they are a state agency, they, they did pass on those things to us as well. But I'm not aware of any, other than them telling us, hey, these are the restrictions as of right now. This is what you need to do. I don't think they changed any of our rules.
Were they a go-to source if you had questions as well?
Sometimes, yeah. They're also helpful in finding out some of those kinds of things if you don't know. So
if there are legal questions, which the association or the board
most of the time when you call the board, they would refer you to the statutes and tell you they don't give legal advice, but they can refer you to where it is in the books. Mm-hmm. So sometimes that's helpful in finding out things. We run into issues at different times with right to disposition and things that we need clarification on, knowing who's in charge when somebody passes away. So,
are there things that you hope funeral home owners and administrators learn or take away from managing these systems during a time of a global healthcare crisis?
Well, I know that it's easy to get discouraged. It was very discouraging when we were under restriction on the number of people that could come. We were trying to figure out how can we serve these families properly, how can we provide a dignified, service and burial for the individuals that have passed away. And there were just a lot of questions. It was very easy to get discouraged in that time. I would just say I hope that everybody learned that it's okay to change your policies a little bit. It's okay to not just do things the way we've always done them. Sometimes you have to adapt and change and progress with what's going on in the world around you. And I hope that other funeral homes recognize that and are able to embrace the differences and grow from that and begin to move forward and know that we can still do what we need to do and have a lasting impact in our communities. It just might look a little different.
Okay, so now I have a few questions about COVID on a personal effect. Mm-hmm. When you first started wearing PPE, do you remember first time you put it on and how it felt?
Well, I wear eyeglasses, and so every time I put on a mask, my glasses would fog up, and it was very frustrating. And then those things behind your ears would make my ears sore if I wore a mask for a long time. I didn't like wearing a mask. But I wore it because I needed to for my own protection and also to protect the people around me in case I was carrying something. But I just started, my initial thought was, well, I hope this doesn't last too long, and I was having a discussion the other day. I can't believe it's been 2 years. The last 2 years have kind of been a blur.
Mm-hmm. How did the lockdowns affect your day-to-day activities related to family?
My family?
Mm-hmm.
Well, we were, as I mentioned before, since my daughter was homeschooled, that didn't affect us a whole lot. I was, I considered myself, even if I wasn't on the list of essential employees, that we were essential and we were going to be here and have our doors open and serve, our community when they needed us. And so, my life didn't change a whole lot. I'm either here at the funeral home or at my house. I don't have much in between. So when I was here, when I needed to be here, I was here and working. Then in my wife's job, her job sort of turned into a work from home position where she did most of her work via Zoom meetings and that sort of thing. But outside of that, I mean, there wasn't a whole lot different, for us, because I just felt like I had to work no matter what.
Mm-hmm. Do you remember when winter 2020, there was a lot of discussion about a second wave of COVID aligned with the change in the weather? And maybe this was more, maybe I have the year wrong on there, so maybe it was more after, when that.
Yes, so we went through that first. It finally came to Oklahoma in the fall, I think, in winter of 2020, and then by springtime, things kind of loosened up. I mean, we were seeing less deaths. The case counts were coming down. They kind of lifted a lot of restrictions. The summertime came. And then we did see another kind of surge in this last winter. I think when the weather gets cold and people start staying inside, I think there was that, and then this Omicron variant or whatever it was, and the one before that, I can't think of
Delta?
The Delta variant. That those things, kind of reared their ugly head again, and that's when we saw another kind of large increase in cases and an increase in COVID-related deaths. And right now, I'm hoping that we're on that kind of downward trend again. It's we haven't had any COVID-related deaths in a couple of weeks, 3 weeks, and so there for a while again that was a lot of what was happening. Mm-hmm. So I've got my fingers crossed that I'd like to see it just go away.
Did COVID considerations change the way you were able to celebrate holidays or gatherings with your family?
Yes. My schedule's always been kind of crazy. Just being the only funeral director here, it was always difficult for me to, commit to holiday gatherings and things like that. I would try and get away if I could. But that first winter, we just stayed home, just our core immediate family group. I went over a year without seeing my parents, who live, a few hundred miles away in eastern Oklahoma. That was hard. We talked on the phone, but I didn't physically see them or wasn't around them for over a year, because we were so busy here at the funeral home, and I just knew that I didn't want to be the one to take something to them if, that was going to potentially make them sick. Mm-hmm. So.
Okay, when the COVID vaccines came out, you talked about how the tier, the first in line for the vaccines. So were there other things that stood out to you about how they rolled out the availability of the vaccines?
It was confusing. Like I said, I never could get anyone to tell us exactly where we fit into the equation and what priority funeral home employees were. And my employees ended up just getting in based on their age initially to get vaccinated, and then I didn't get vaccinated for quite a while. And
you're being the son of a scientist, veterinary science, brothers are scientists. Did having family members with that knowledge about more than the everyday person,
sure,
did that affect your perspectives at all?
Well, yes and no. I did talk to my dad quite a bit about what was going on at different times in the vaccine itself, and we talked about how the vaccine itself worked. This type of vaccine versus other types of vaccines, and he's a pretty smart guy, and so I that helped me understand those things, better.
Mm-hmm.
And he told me he didn't, I asked him if he was going to if he and my mother were going to get vaccinated, and he said he thought it was his Christian duty to do that. And so they're vaccinated. I ended up, my wife and I are vaccinated. Our daughter's vaccinated.
Mm-hmm.
But, I know there's a lot of question about that still. There's, people that don't want to, because again, it's just the fact that we think we understand something, and then there's new information that comes out that says, oh, we were a little bit wrong, we're going to change this or that. So that just creates, unfortunately creates, I think, doubt and suspicion for some people.
Probably not having a good understanding of science.
Correct.
And how it works.
Absolutely. I would agree with that.
Yeah.
And so I would say most people don't. I mean, science, some people love science and we're good at science in school. I like science. But I've got members of my family that my kids, they just hated science. So.
Okay, I have to ask you, because of the veterinarians in your family, about the ivermectin.
Well.
Treatment.
How
was it treatment?
I don't know if that was a good idea or not. It typically kills parasites. I don't believe a virus is a parasite. And I know from down in eastern Oklahoma, it's fairly rural, agricultural. There's a lot of farmers and ranchers in that area. I know several people that have taken it. I don't think my dad would recommend it. It is a veterinary product. It's not really made for human consumption. But anyway, I know a lot of people that have taken it and they think that it helped them, but I'm skeptical of that. I'm not going to do something that unless my doctor tells me to,
Do you think the mindset in that part of the state is different than this part of the state?
I do, in some ways. And there's parts of this state too. I mean, I think it's sometimes when you get into a more of a rural area, and like less urban, you have, different mindsets. I don't know if that's related to just, if it's related to education level, if it's related to, financial status. There's a lot of things, I think, in just family mores and things that you experience, in your culture that, certainly sometimes people that come from smaller areas, they want to stay there because they feel safe and protected there. And so whatever anybody tells them there is the way they're going to live their life and what they're going to believe, And so if you never leave this bubble, so to speak, then you're not going to see any other point of view or really understand it. And I think maybe that's part of what's happening. And I wouldn't say it's necessarily just it may just be more rural parts of the state, small towns and things, people that have grown up in a small town, stayed in a small town their whole life, never ventured out, never really expanded their worldview. I know there's a lot of people that I grew up with that are still there, and it's a wonderful place. It's a beautiful place in eastern Oklahoma. I don't happen to live there right now, but maybe one day I'll retire back there. But I think sometimes you have to go out and experience the world, and you don't have to be a world traveler or go, live overseas or something like that. But I think you have to expand your knowledge and give yourself the opportunity to learn something different. I like to try and learn something new every day, whatever that is.
Okay, we are winding down.
Okay.
I have a few more things here. So, how have you evaluated risk over time? For example, if you were mask wearing frequently, how did you decide when to stop, if you decided to stop? And how did that feel to change
Well,
the routine you were in?
I've been, like I said, I watch the news quite a bit. So I've been watching the case counts and just knowing, what we're seeing as far as how many people that are, coming into the funeral home that have passed away from COVID. And as we see those numbers go down, if I'm in a big crowd and I know we're going to be in a tight space or in my, our funeral home chapel, and there's going to be 150 people in there, then I typically am going to wear a mask. If I feel like I'm in a situation where I can stay, a certain number of feet from somebody, if they sneezed or something, it's not going to get on me, then I don't always wear a mask. I have sort of maintained that sort of throughout this whole time. And, I didn't wear a mask at my house. I didn't wear a mask when we didn't have a lot of people in the building, things like that. But when I was with families and people who were coming in from the outside and we were having services, I wore a mask, and then I was always ready to take it off. This is not comfortable to me. It's liberating to take it off and say, oh, I don't have to wear this right now, But I still think that we're going to continue to see, we'll see what happens. I think that COVID is something that we're going to probably have to live with, and it's probably going to be something like the flu where they're going to offer a shot every year, the booster shot of the COVID vaccine or whatever, and it's just going to be a part of our everyday, existence like the flu or anything else is. And hopefully, it gets to the point where it's not causing too many deaths, But even with the flu, there was always deaths of folks who were, had comorbidities or were, already had poor immune systems or had other health issues that, the flu might cause them to die. So I think we're just going to have to deal with it. So I think we'll continue to see masks. But I've seen less and less people wearing them right now.
Mm-hmm. I see that too.
So,
in what ways has your experience transformed how you think about family, friends, and community?
Well, I don't know if this particular experience has really changed a whole lot about the way I believe about that, but I think working in the funeral business, and I've been a funeral director for 23 years, and I've taken care of thousands of families. I've seen all kinds of things happen, deaths that have occurred from tiny babies to people who have lived to well over 100. And I think that being around situations where you have to 100% be in touch with life and death, that with my Christian faith has just taught me always that life is precious and life is a vapor and God doesn't promise us tomorrow. And so, it probably makes my wife unhappy because I don't want to have a fight, go to bed angry. But I just want my family to know every moment of every day how much I love them and how much I care for them, because I don't know if I'll be here tomorrow. I don't think I'm fatalistic in that regard, but I think it's realistic in that we really don't know what the future holds. I could perish in a car crash or something on my way home from work tonight, and I hope not, but I want to be ready in my heart for that with my faith, and then also with my family that they would never have any question about whether or not I loved them or cared for them. So I try to not have conflict. I try to make sure that the people that I care about know that I care about them all the time, and because you just never know. And does that answer your question?
That's your value system.
I think that the COVID maybe made that even maybe more prevalent because we had a lot of people, and we see those situations that they were younger. They didn't expect, they didn't think that they were going to catch COVID, and it caused them to die. We've seen a lot of heartbreak and a lot of tragic situations. Families that, I've dealt with families that lost multiple family members because of COVID. I know some people that both of their parents died within a short period of time. And so we were here, to help navigate that and help those families through that. And just seeing those things on a day-to-day basis, it just causes me to, inwardly it just constantly reminds me of those things. But I think even before that, I already sort of had that mindset, but it maybe did bolster it a little bit.
Did you see or hear regret with people if their minds changed about COVID?
I do. We did. We've had, there was a period of time where there was some people that were like, this isn't real. This is some kind of a hoax. We don't want to do this. The government's trying to make us do something we don't want to do. And my thought was, come down here and spend a day with us here, and you'll see this is very real. There were people that, were in denial about it. There were people that said, no, I'm not going to be vaccinated, and then ended up getting COVID and dying. And then we heard those families say, I wish they would have just done different. I wish, we were vaccinated. We told them you need to get vaccinated. I wish you would have gotten vaccinated, and then we had people that wanted that even spoken, at the service, or, make sure everybody knows,
Yeah.
It's too late for this individual, but you need to go do this, So it's been a very interesting to see those dynamics. But yes, I've seen people whose minds were changed, and unfortunately, after someone had passed away.
Was there extra anguish that people dealt with because of that?
I'm sure. And then we've also had situations where we had, somebody who knew they were sick, that didn't die, that infected somebody, a loved one that did die as a result of COVID. There was a lot of guilt and things associated with that. And, some of those things are really kind of out of our control. And these were even some of them vaccinated people. So the virus has been very hard to understand what it does to certain people in certain situations. But even those types of things that, I had a daughter tell me, she says, I know I brought this home to mom, and then she got it and she died. And, that's heartbreaking. Mm-hmm. Nobody wants to feel like they need to be responsible, to be responsible for something like that. And it's really not her fault. No. It was a negative circumstance,
You mentioned that some people wanted something said publicly in the services. Were you seeing that with the obituaries, that they wanted it in the obituary as well?
We never did say anything like that in obituary. We did ask, there were people that were very cautious about COVID that wanted to say, in the obituary, masks are required or things like that. So we were sometimes putting verbiage in there to that effect. Mm-hmm. There wasn't nobody ever in any of my obituaries. I kind of read obituaries from all over the United States, and there were some places where I read obituaries where it said, hey, this person would want you to know you need to get vaccinated, So, but we didn't have anything specific here other than, due to COVID-19, restrictions, everyone's required to wear a mask,
Do they write the obituaries? Do you write them?
We generally, most of the time, we write obituaries, and then with the family's input, and then let them make any necessary changes. We want to make this process as easy as we can.
Mm-hmm.
And so for me, my belief is that if I write an obituary and hand it to them and say, edit it as you want, that's an easier prospect than for me to say, when you get the obituary written, you can give it to me. Because they don't do that on a daily basis. We do have some families that want to, and certainly we don't take that away from them. So if they have the want to, and they want to write up their own obituary, we certainly do that. So every case is a little bit different, but I would say probably most of the time we do them ourselves and then let them make any changes.
Does Blanchard have a newspaper still?
We do. It's a
Print
weekly
newspaper.
paper called the Blanchard News. It comes out on Thursdays.
Did they do any coverage or stories about what you all were going through?
Not us particularly, no. They reported COVID numbers and things like that from the state level, like every other news outlet. But they didn't really talk about specific businesses or
Healthcare workers? No.
Not that I can recall.
Is there a hospital?
There's not.
Closest? Okay.
So our closest hospital, most of the time, if somebody needs to go to the hospital here, they either go over to Norman or to Chickasha.
Norman had a lot going on in their city with their city requirements.
Yes.
During COVID. Did that affect this community that's, a little ways outside, a little more rural?
Well, there was a period of time where, to all the businesses in Norman, and this is where a lot of people from here have to go shopping. That's our bigger shopping outlets there. So all Norman businesses for a period of time required that you wear a mask to go in. And so that changed some people's, day to day here. There were some people I know that said, well, we're not going to go over there because we're not going to wear a mask. And there were people that just put their mask on and went and got what they needed, So I do know they did that for a while, and then they lifted their citywide mandate at some point.
Yeah. Knowing what you know now, what do you think that individuals, communities, or policymakers need to keep in mind for the future? Imagine somebody listening to this 50 years from now.
Maybe just, I don't know, I think just centralize information and try and make sure it's all good information before it goes out. But I know there's always, when something's happening, people want answers. And so I think through some of this, we were just getting answers because somebody said we need an answer. And it wasn't really fully, formed or thought out. I don't know. It just kind of created, confusion and doubt and suspicion of whether or not we were being told the truth. I think hopefully that, through all this, that the powers that be have kind of learned that there needs to be a better process, that maybe we'd be more prepared for something like this in the future. I know, they say that these pandemics and things come around every 100 years or so. Maybe this one will go away and we won't have to worry about it for 100 years. But the problem with those things is that a lot of times, everybody that was around and experienced those things and has any good input isn't there to give sage advice at that time. So it's like a brand new ball game. But I assume that's what, your project would help with, is maybe that would provide some of that insight for somebody who was in a place to make decisions at that time.
We hope so.
Yeah.
Is there anything that we didn't cover that you would like to share?
No, not off the top of my head. I don't think so.
Okay. Well, thank you very much for
You're very welcome.
participating in
Thank
this
you.
interview.
All right.
Really appreciate it.
You bet.